Good evening. I'm your therapy coach, Rod Way, and welcome to the Coach's Corner. Today, I would like to talk to you about the power of understanding. Yes, the power of understanding. What is understanding? By definition, there's two parts I would like to use. One, it is the mental process of a person who comprehends or comprehension. The second part of that definition is knowledge of or familiarity with a particular thing. Get it? The mental process of a person who comprehends or comprehension. Two, knowledge of or familiarity with a particular thing. Why is understanding important in mental health, you may ask? Let's talk about that a little bit. The first reason why understanding is important in mental health is because it eliminates ignorance for both the therapist and the client. Oftentimes, I have individuals that will come in as clients and they're not sure why they're here, or I may not understand clearly based on their intake paperwork why they're seeking therapy. So what I would do is when they come in, I will sit them down, we would talk and go over their intake paperwork, and I will try to get an understanding of what they're dealing with, the type of symptoms they're having, where they are at the moment versus when they're complete the paperwork. Because sometimes uh, they might have been in distress whenever they done their paperwork, and when they came in for their session, depending on the time frame, they may not be in the same mindset or experiencing the same emotions as they did when they first completed the paperwork. So when they come in, my first thing is to eliminate that ignorance for myself as to what is going on with the individual to get an understanding of what that person needs at the moment. And on the opposite side of thing, for the client, me being able to eliminate or to the ignorance for them is for them to understand from me what am I able to do or what they will be getting from me based on the information that they provided. Okay, so let's not forget that. So the first step is to eliminate ignorance for both therapist and client. Two, it provides a general knowledge of what is going on. That is an important thing. We need to understand as therapists what is going on with our clients, what is going on with the patient. Also, the client needs to know what's going on in the therapeutic process. So, what that looks like is you sit them down and you talk about the pros and cons of the situation, what's going on, what to expect, um, things like how the therapy sessions will work, time frames, the style of therapy you're using, what to expect from you as a therapist. That provides them a knowledge about the whole entire um, process of why they're there and what they expect while they're there. Okay, it provides a general knowledge of what is going on. So the third part is it opens the door for exploration of treatment methods. Yes, when you get an understanding of what the client is dealing with as a therapist, it opens the door for me as a therapist to explore various therapeutic methods or treatment methods to be able to work with my clients. And it also gives them an opportunity to explore and look at other methods that will fit them or to opportunity to explain those methods to them so that way they can get an understanding of my approach to therapy or my approach to their problems. And it's important for a client to know and understand your approach to therapy and how you're going to apply that approach to them so they can have the ability to uh, see if that fits them, if your style works for them or not, versus just trying to force something on them. So yes, it's good to have an understanding on that. Also, it challenges the stigmas and misinformation. A lot of times when clients come in, and I see this a lot when they either been pre-diagnosed with something or they're coming in looking to be diagnosed, or they're depending on the issues or things that they're dealing with, the stigma behind certain diagnoses or the misinformation that they may have read online or heard from friends, family, and different individuals may lead to a lack of understanding of what their problems are and how to solve their problems. Okay. So it is my job to work with them to eliminate those stigmas and eliminate the misinformation and provide them with a better understanding of what they're dealing with. Okay. Because the more they can understand, the better it is for them to be able to work on their problems and solve problems. Okay. So the last part of it is to provide clarity. Providing clarity in therapy is important because of the main issue. It allows you to be able to establish a process, a rapport, and also it allows you to be able to work with your client in a more effective way to help them solve problems in their lives. Understanding often gives clarity, even though we may not agree to certain things, because understanding and agreeing is not synonymous of each other. But the ability to understand something helps us to be able to rationalize and be able to work with things that are unfamiliar to us. Okay, as the definition said, it brings a familiarity to a particular thing. So if I was diagnosed with bipolar, or there was a client that was diagnosed with bipolar, and they were coming in and they wanted to talk about what bipolar 1 is and how it impacts them and what it looks like, based on what they've already been exposed to and how they've been um, told about what bipolar 1 is, it may not be clear to them as to what they're really dealing with. And I'm going to give you an example of this. I had a client recently who was sharing some information about their past, and they talked about being diagnosed with something. And they were wondering, well, I was told that if this happens or if I'm diagnosed this, I will always be this. So my question to them was, eh, you know, if you were going to your medical doctor for a cold and you were diagnosed with a cold, once the doctor understood what you were dealing with and your symptoms, and he gave you something to treat it, and your symptoms go away, does that mean you still have a cold? And they said no. I said, but does that reduces the chances of you ever catching a cold again, or your ability to catch a cold again? They said no. So I said, understand this: diagnosing someone in mental health is similar to the same way doctors in the medical field diagnose individuals. They're diagnosed based on the presented symptoms at the time of your evaluation or your assessment. Okay. Over time, those things can change. Some of those symptoms can go away. Some of those symptoms can actually stay present. But each time you go in and you're assessed, it may look differently. So your diagnosis can change. And there's a possibility that symptoms can go away and never have another episode ever again. So without that understanding of providing that clarity for them to comprehend what that looked like, they were stuck in a mindset where they didn't feel like they can overcome the obstacles that they were dealing with that has been hindering them for the past year and a half. But the expression was from them to me was, hey, now that I understand this, it makes me now want to work harder to eliminate these symptoms. What do I need to do to eliminate these symptoms? How can you help me eliminate these symptoms? That created our treatment plan or our method of being able to help and work with this client. So, with that being said, I'm going to go back through it again. As I said, the power of understanding. Understanding is a very, very, very important part of what we do as therapists. We, whether if it's cognitive therapy, motivational interviewing, whatever type of therapy approach you use, the main objective of all those things is understanding. Without understanding, it's hard to solve problems. Okay. And as I end this session, I want to be able to again, why is understanding important when dealing in mental health? One, it eliminates ignorance for both the therapist and the client. Two, it provides general knowledge of what is going on. Three, it opens the door for exploration of treatment methods. Four, it challenges stigmas and misinformation. And five, it provides clarity. Okay. So thank you for tuning in and coming into the coach's office, the coach's corner with me. And I'll ask you to follow me on social media, on Facebook, Therapy Coach One, on YouTube, X, and LinkedIn, the Therapy Coach. Okay. Don't forget to subscribe to the YouTube channel, follow the videos, follow the episodes that are coming, the shorts and these type videos. And I appreciate you coming in. And I hope that there was something that was shared with you today that allow you to be able to score a touchdown in your life. Have a great day.